Welcome everyone to a new episode of Marian Ayurveda. In the last two episodes, we talked about different types of coughs. In the first episode, we discussed coughs related to fever. In the last episode, we talked about coughs caused by allergies. In this episode, we are going to talk about coughs that occur at night or coughs that happen when lying down, and also some other different types of coughs, like coughs that come while talking. So in this episode, we will be thinking about these kinds of coughs. Let's think about it. Many people say that they get a cough when they lie down at night. Why does that happen? For some people, the cough doesn't start immediately after lying down at night. Instead, after 1, 2, or 3 hours, around midnight, the cough begins. Why do these kinds of coughs occur? Let's now think only about a cough that comes at night. Let's consider the cough that starts immediately after lying down at night. After lying down for about 5 or 10 minutes, the cough begins. Why does this happen? When we lie down, our digestive juices and throat all come onto the same plane. These digestive juices, the ones that cause acidity, often create irritation in the throat when we are lying down. If you are sitting, there's no problem. The acid, the gastric juice, stays in the stomach. There is no problem. But when you lie down, everything comes onto the same plane. Some components of the acidity or some parts of the gastric juice come up and cause irritation in the throat. That then turns into a cough for us. So reducing acidity, there is a very important thing. Then the second thing to mention is the cough that comes immediately after lying down, as we discussed. Another thing is that when you lie down, the cough starts around midnight. We have seen this very specifically in children, and many people have come with this issue. It happens after sleeping for 2 or 3 hours. A major reason for this is worms. In children, worms are most active around midnight. It is when children are asleep that the worms come down and cause discomfort. Certain chemicals released by the worms can cause a cough or an allergy-like reaction in us. The chemicals from the worms can turn into an allergy. When the activity of the worms increases at midnight, children start to cough. In such cases, when children have this kind of cough, if we give them medicine for worms, we can see that the cough reduces. Another thing to mention is that it is cold at night, isn't it? We often say that after turning on the AC, if we are exposed to cold air, we get a cough. Or after lying down at night for a while, we start to cough. What is happening there? When it gets cold, the flow of blood through the blood vessels decreases. So different parts of the body or the lungs may not get enough oxygen. In response to this lack of oxygen, the body's tendency is to produce a cough. In such cases, what we need to do is to give medicines that improve blood circulation in the body. Similarly, as I mentioned in the previous episode, for those who have fever, especially those with very minute infections in certain lobes of the lungs, this tends to worsen at night. I can't say for sure if that's because of the cold, but for those with an infection, as I mentioned, it was only after treating the infection, like inhaling smoke from Google or Kuntirikam, that we were able to relieve their fever or the cough that occurs while lying down at night. So we have now discussed 4 types of nighttime cough. One is caused by acidity, another by worms in children, another due to poor blood circulation at night because of cold, and some fevers that occur in the lungs at night where they experience a slight chill during the night. This is a particular characteristic of this fever. At night they experience an intense chill, a very distinct coldness. So if they have that kind of cough, they can understand that there is still a minor infection left inside the lungs. So these 4 types of cough can occur specifically when we lie down at night. But then some people say that almost everyone with a cough experiences another type of cough where there is phlegm stuck in the throat that doesn't go away even after spitting. So to clear this phlegm, we artificially induce a cough. As they say, and after struggling for a while, when the phlegm is stuck in the throat like this, it causes discomfort. So this cough, in order to clear the phlegm stuck in the throat, becomes a forceful hacking cough. After struggling, a small amount of phlegm will come out. This is a different type of cough. Why does this happen? This mainly happens to people with acidity. In people with acidity, what happens is that this acid, gastric juice, here, we have a slippery epithelium in this area that normally prevents phlegm from sticking. That's called squamous cell epithelium. This epithelium is what covers our throat and all. Here, when acidity occurs, this slippery layer or skin in the throat gets eroded and becomes rough. Just like moss sticks to a rough surface, the normal mucus in the mouth will stick to that rough area. So, to expel this mucus, we have a type of cough. That is what is referred to as another type of cough. So in that case too, what we need to do is use medicines that treat acidity. Some people start coughing while talking. Why does coughing occur while talking? When we talk, the throat, or more specifically the vocal cords, require the most blood circulation. When blood circulation decreases or when the oxygen level drops, people tend to cough while talking. Similarly, for some people, the bruises or injuries in the chest area, until those bruises heal, the cough will persist as long as the bruise remains. Then there are some people who cough and vomit. All of this is related to the functioning of our throat, isn't it? the function of the esophagus is always downward. For some people, it always tends to go upward. We have seen many people like that who are constantly coughing and vomiting. That kind of cough is also seen as being related to acidity. Similarly, the cough that occurs in pregnant women. Why does this happen to them during pregnancy? The function of the intestine, the downward movement, is obstructed due to the growth of the uterus, so it moves in the opposite direction, upwards. They also experience cough. Even then, when the function of the intestine is mostly downward, let's say, for example, if you drink water boiled with herbs like aranda, castor, anaca, or E and roots, it is possible to get rid of such coughs. In the same way, for those who have trouble with gas, if the food remains undigested after eating, the gas rises upwards. We know well that in our body, gas is supposed to move downward. For those with poor digestion, often we try to aid digestion by taking a little dry ginger coffee or similar remedies. Those with indigestion should try such things, and then digestion improves significantly, the gas functions normally, and the upward movement of gas decreases and it moves downward. There are several types of coughs like this. Many people have asked about this, especially when using air conditioning. So there are different types of coughs. As I said, there are about 10 to 15 types of coughs, and we have discussed them over 3 episodes. Beyond this, I haven't seen any major issues related to cough. All of these can be treated. Then there is something called COPD, which affects the lungs and is a bit more difficult to manage. However, even then, issues like acidity in the phlegm and habits like smoking often lead to such conditions. Even so, if we can control acidity to some extent and provide medicines that help the lungs expand, we have been able to manage and survive these conditions as well. Beyond this, there aren't many other major types of coughs. No matter how old the cough is, what we need to pay attention to is that in Ayurveda, there is a certain approach. People often think that giving everyone Vyoshadi Churnam, Talisapatradi Churnam, or Dashamuli will help. But for those with allergies, these can actually increase allergic reactions. That's why many people say that taking Ayurveda medicine doesn't cure them. Often these medicines have a pungent taste, and for those with allergies, medicines with a pungent taste should never be used. That's why self-medicating for allergic cough is very foolish. However, for coughs caused by phlegm, fever, or cold, we can do all these things, like using dry ginger coffee or black pepper remedies. But for those with allergies or acidity, if you try such self-medication, I feel that in Ayurveda, 99% of the medicines for cough contain these ingredients. As I said before, there is no decoction without dry ginger, and there is no medicine without pungency. Everything contains something spicy. So for those who have a cough, especially allergic cough, it is always best not to self-medicate. I would say if you are looking for a simple home remedy, and if you are familiar with plants like wild onion, vayalsoli, if you can get them, boiling its water and drinking it can help to some extent in relieving allergic cough and cough caused by acidity. Still, I must say there are a lot of thoughts to consider. As I mentioned, there are about 10 to 15 types of coughs. Only if we can differentiate between them can we develop the right treatment. Anyway, we can try to control our diet a bit. The remedies I mentioned, whether your cough is due to fever or not, like inhaling the smoke of dried turmeric or drinking wild onion water, are good. We can try such things. Let's meet again with another disease. Thank you.